Good day, Philippines, and good day, University of Baguio School of Nursing. And this is the News Nightingale. I am Janina Abrin from BSN3 and CB1, and here are the contents for the news today. The urinary tract infection, or also known as UTI, is an infection that occurs in any parts of the urinary system. Fun fact that the normal urinary tract is sterile above the urethra, but UTI develops when pathogenic microorganisms occurs in the urinary tract itself. UTIs are generally classified as infections involving the upper or lower urinary tract and further classified as uncomplicated or complicated depending on the patient's other related conditions. The UTI has two parts, which are the upper and lower urinary tract. Here is Kathleen Joy Boreros for more details. Kathleen?
Thank you, Janina. Lower urinary tract infection includes bacterial cystitis, inflammation of the urinary bladder, bacterial prostatitis, inflammation of the prostate gland, bacterial urethritis, inflammation of the urethra. The sterility of the bladder is maintained by several mechanisms, especially important since the urethra is considered a clean, not a sterile space. The physical barrier of the urethra assists in keeping bacteria away from the bladder, while the urine flow helps to carry any bacteria away from the bladder. Upper urinary tract infections are much less common than those in the lower urinary tract. Pyelonephritis is a bacterial infection of the renal pelvis, tubules, and interstitial tissues of one or both kidneys. Bladder or prostate tumors, strictures, benign, and urinary stones are some potential causes of obstruction that can lead into infection. Back to you, Janina.
One of the most important parts of the UTI is the etiology itself. Here are Patricia Maytomelden and Mary Joy Gondran for more information. Ladies, take the mic.
Thank you, Janina. So for the etiology of urinary tract infection, let's first start by defining what etiology is. Etiology is known as the cause or origin of a disease or an abnormal condition. It has been acknowledged that urinary tract infection typically have a well-established and consistent etiology. The urinary system is well-designed and can keep E. coli and other type of microscopic invaders at bay. For instance, urinating usually does an excellent job of flushing out lingering bacteria from the urethra before it causes any issues. But when this defense fails, bacteria such as E. coli will enter the urinary tract wherein urinary tract infection can develop. So for the bacterial invasion of UTI, increasing the normal slow shedding of bladder epithelial cells, the bladder can clear large numbers of bacteria. GAG, a hydrophilic protein, normally exerts a non-adherent protective effect against various bacteria. The GAG molecule attracts water molecules, forming water barrier that serves as a defensive layer between the bladder and the urine. Urinary immunoglobulin A, or also known as AGA in the urethra, may also provide a barrier to bacteria. And then here's Patricia to further discuss the etiology of the urinary tract infection.
Next, let's talk about the difference between uretrovesical and uretrovesical reflux. An obstruction to free-flowing urine is a condition known as uretrovesical reflux, which is a reflux of urine from the urethra into the bladder. With coughing, sneezing, or straining, the bladder pressure increases, which may force urine from the bladder into the urethra. When the pressure returns to normal, the urine flows back into the bladder, bringing into the bladder bacteria from the anterior portion of the urethra. The uretrovesical angle and urethral closure pressure may be altered with menopause, increasing the incidence of infection in postmenopausal women. While the uretrovesical reflux refers to the backward flow of urine from the bladder into one or both ureters. Normally, the uretrovesical junction prevents urine from traveling back into the ureter. The ureters tunnel into the bladder wall so that the bladder musculature compresses a small portion of ureter during normal voiding. When the uretrovesical valve is impaired by congenital causes or ureteral abnormalities, the bacteria may reach the kidneys and eventually destroy them. So what are the factors that contribute to UTI in older adults? So first is cognitive impairment, second is frequent use of antimicrobial agents, third is high incidence of multiple chronic medical conditions, fourth is immune compromised, fifth is immobility and incompetent emptying of bladder, sixth is low fluid intake and excessive fluid loss, seventh is obstructed flow of urine, examples are urethral strictures, neoplasms, clogged indwelling catheters, and lastly, poor hygiene practices. Again, I am Patricia. Back to you, Janina.
The risk factors of UTI should be known by everyone to have more knowledge. Chaira Meyakas, are you there?
Yes, Janina. For the risk factors of UTI, the contributing conditions are female gender, in which they are more often to get UTI because women's urethra is shorter than men. Diabetes. Higher glucose concentrations in urine may promote the growth of pathogenic bacteria. Pregnancy. The pee has more sugar, protein, and hormones in it. And also, in pregnant women, the growing uterus presses on the bladder that makes it hard to let out all the urine. Neurologic disorder. Damages or changes in the nervous system and infection can cause neurogenic bladder, which is the nerve that carry messages back and forth between bladder and the spinal cord. For gout, uric acid crystals are deposited in the kidneys, in which this causes kidney stones, which are very painful, and if left untreated, they can block the urinary tract and cause other infections. Altered states caused by incomplete emptying of the bladder and urinary stasis. Small amount of urine inside the body can collect bacteria and other debris, resulting in infection. Decreased natural host defense or immunosuppression. Poor inflammatory response against bacteria results to UTI. Next, inability or failure to empty the bladder completely. It can lead to abnormal urine flow that gives bacteria at the opening of the urethra a chance to infect urinary tract. Next is inflammation of abrasion of the urethral mucosa. It causes bladder wall irritations, which results to problems in the normal passages of urine. Instrumentation of the urinary tract, such as catheterization and cystoscopic procedures. This can allow bacteria to enter the body. Obstructed urinary flow caused by congenital abnormalities, in which abnormalities can result to recurrent UTI, which damage the kidney or other structures. Urethral strictures. The buildup of scar tissue in the urethra, which is the passage that empties the urine from the bladder, slowing or blocking the ability to urinate. Contractures of the bladder neck. Excessive scarring at the level of the bladder opening, typically causing narrowing of the urinary tract, resulting in slow urinary stream, difficulty emptying the bladder, and other urinary symptoms. Bladder tumors. It may cause changes in urination, like having to urinate more often than usual. Calculi or stones in the ureters or kidneys. It may block the flow of urine and cause the kidney to swell and the ureter spasm, which can be very painful. Compression of the ureters, in which it can lead to stasis of urine flow, just like the pregnant woman, in which there's a partially or fully prevents urine from leaving the bladder or urethra. This is Chaira Riakas reporting for the risk factors of UTI. Back to you, Janina.
The most important part of UTI is the pathophysiology, wherein it will be discussed on how the condition occurs. Here is Jessica Bananya for more details. Jessica?
You got it, Janina. Mukhang ang madami ang malulungkot ngayon, Janina. Dahil ang common practice ng bawat isa, need ng baguhin to avoid infections. As we know, pathophysiology discusses the physiological process associated with a disease. Nalaman na nga ng bawat isa ang cause and risk ng UTI. Pero paano nga ba nagde-develop ang UTI, or commonly known as urinary tract infection? For an infection to occur, bacteria must gain access to the bladder, whereas there are 3 known ways where the bacteria can enter an individual's urinary tract. Namely, these are the transurethral route, which causes the ascending infection, bloodstream, and by fistula from the intestine. But among on these 3, the most common is the transurethral route, where the bacteria from a fecal contamination such as an E. coli colonizes the tissue surrounding the urethra. Then subsequently, this bacteria or the E. coli will enter the bladder. Pero, the bacteria are never always to be blamed. For example, baka naman kasi you have a practice of wiping back from your puwet to front in your vagina kapag naguhugas ka. Due to this, you facilitate the transfer of bacteria sa vagina mo. And once the bacteria gains access sa bladder mo, it will attach to the mucosal surface of the urinary tract para kahit maihi ka, hindi siya kasama sa mawawash out. And alam naman natin na once makadetect yung katawan natin ng pathogen or bacteria, mag-respond agad yan. Pero once the immune system does not respond quickly enough, the bacteria may be able to excessively multiply and evade the individual's defense mechanism. And syempre, madedetect ng katawan natin yung pag-multiply ng bacteria or yung pagdami ng pathogen. So, magre-release siya ng pro-inflammatory cytokines and chemokines para mag-attract ng neutrophils. These neutrophils will regulate the antibacterial defense ng individual sa mismong site ng infection. And as the defense mechanism reacts to the bacteria, it will affect the body in two ways, such as it will elevate the body's temperature wherein yung nararamdaman nating symptoms ng fever, or inflammation of the lining of the urinary tract will start to set in. Dito na lumalabas yung signs of infection, kagaya ng mahapding pag-iihi, ihi ng ihi, o yung pakiramdam na naiihi ka naman pero wala namang lumalabas. Or worst scenario is bloody urine. In terms naman of men, they are known to be less prone to UTIs. This is because they have longer urethras than women because bacteria need to travel a longer distance. Specifically, mas mahaba, mas safe. And just to take away, the incidence of UTI increases in ladies when they participate in a penile vaginal intercourse because this forces the bacteria from the urethra into the bladder. As a famous clinical instructor once said about a smoker boyfriend, akala mo sweet lang siya sa'yo, yun pala, pinapahamak ka na niya. Back to you, Janina.
The diagnostic tests and findings must confirm the said condition. Here we are with Venice, Charmaine Sebastian, and Victoria Ramos for more information. Ladies, the stage is yours.
Thank you, Janina. In assessment and diagnostic tests, as healthcare provider, we have to first assess changes in urine patterns such as frequency, urgency, and hesitancy. Also assess patients' knowledge and preventive healthcare measures. And lastly, assess the characteristic of patient's urine such as color, concentration, odor, volume, and cloudiness. While in diagnostic tests, we have bacterial colony counts, cellular studies, and urine cultures. To further understand this, we have Venice to enlighten us.
So the next one is uterine. It is done with standard uterine swab using fluid from low volume uterine secretion from a uterine brush. A colony greater than 100,000 CFU per ml or colony forming unit per ml in the urine specimen indicates an infection. The presence of any bacteria in specimen are obtained by suprapubic needle aspiration in the urinary bladder, strict catheterization during surgery, or cystoscopy is considered clinically significant. The next one is cellular studies. There are two common types of cellular studies, namely microscopic hematuria and pyria. Microscopic hematuria commonly manifests in urine, but when you view under the microscope, more red blood cells are noticeable. It is typically determined through dipstick tests in the urine sample. About half of the cases, a patient with acute UTI has microscopic hematuria. Patient with UTI often has white blood cells, commonly known as pyria, which is sign of bacterial infection. Renal calculi, intestinal nephritis, and renal tuberculosis also occurs with urea.
To continue, there are other studies too that are included, such as multiple dipsticks. It tests WBCs. Sexually transmitted infection tests are also performed as symptoms may be similar to UTI. X-ray images are also included. CT scan, it scans pyelonephritis, and lastly, ultrasonography. It detects obstruction, abscess, tumor, and cyst. These are all helpful tools to diagnose UTI. Back to you, Janina.
Clinical manifestations should be reiterated for a better understanding. Serving you is Christian Bandia for more details. Christian?
Thank you, Janina. So here are the signs and symptoms of urinary tract infection, or also known as UTI. First sign of having UTI is frequent emergency urination, having a burning feeling when you pee, voiding in small amounts at a time, incomplete emptying of the bladder. UTI can also affect our abdomen, specifically our lower abdomen. Thus, you may experience pain and discomfort. UTI usually make urine cloudy, dark, foul-smelling, and can also cause bloody urine or hematuria. Malaise, chills, and fever, and lasting WBC count of greater than 11,000 cubic meter on urinalysis are indicated by the growth of bacteria and is subjective of UTI. Back to you, Janina.
The medical and nursing interventions are important to have more effective holistic care with someone who has UTI. Here are lovely May Fanugao, Daira Copaos, and Jarafel Manzano for a better understanding.
Thank you, Janina. And for the management of UTI, it is typically involves pharmacologic therapy and patient education about measures for preventing infection. For the acute pharmacologic therapy, the ideal medication for treatment of UTI is an antibacterial agent that eradicates the bacteria from the urinary tract with minimal effects on fecal and vaginal flora, and thereby minimizing the incidence of vaginal yeast infections. There are various treatments that are successful in treating uncomplicated lower UTIs in women. There are shortened course of antibiotic therapy, and it is a single dose administration that lasts for 3 to 4 days regimens or 7 to 10 days for patients in institutional settings. Some of the medications commonly used to treat UTI are the antibiotic cephalexin, to treat the genitourinary infections, ampicillin, amoxicillin, cotrimoxazole, and phenazopidine for relief of burning pain and other symptoms associated with UTI. Regardless of the regimen prescribed, the patient is instructed to take all the doses prescribed by the doctor. Here are some of the nursing interventions. First is relieving the pain of the patient. The pain associated with UTI is quickly relieved once effective antimicrobial therapy is initiated. Antipasmodic agents may be given to relieve bladder irritability and pain. Analgesic agents and the application of heat to the perineum help relieve pain and spasm. The patient is also encouraged to drink liberal amounts of fluid, and water is the best choice to promote renal blood flow and to flush the bacteria from the urinary tract. There are drinks or foods that considered as urinary tract irritants such as coffee, tea, citrus, spices, colas, and alcohol, and it should be avoided. Frequent voiding every 2 to 3 hours is encouraged to empty the bladder completely because this can significantly lower urine bacterial counts, reduce urinary stasis, and prevent reinfection.
So, for the long-term pharmacologic therapy of UTI, even though women often respond well to a 3-day course of short pharmacologic treatment for UTIs, roughly 20% of women who receive this care can still experience recurrent infection. Let us know why. Within 2 weeks of treatment, infections often return because the original problematic strains organisms are still present in our body. Relapses imply that the initial treatment was ineffective or inadequate. There are more than 90% of women who get recurrent UTIs because of reinfections with new germs. All women with recurrent UTIs may be advised to start treatment on her own and to notify her healthcare practitioner only when symptoms continue or the number of treatment episodes reaches 4 in a 6-month period of the diagnostic evaluation that should indicate no anatomical abnormalities in the urinary tract. The patient might be instructed on how to utilize tip slide culture instruments to find germs. If infection returns following the completion of antimicrobial therapy, a second brief course of full-strength antimicrobial therapy lasting 3 to 4 days may be advised, followed by a regular evening dose of an antibiotic medication. And the drug is given every night for 6 to 7 months if there is no recurrence. In individuals with recurrent infections, long-term usage of antimicrobial medicines reduces the chance of reinfections. So after the treatment and sterilization of the urine, low-dose preventive therapy at bedtime is often prescribed. Current evidence of the effectiveness of daily intake of cranberry juice to prevent UTI is inconclusive for monitoring and managing potential complications. The early detection of UTIs and timely treatment are crucial for avoiding recurrence and other complications like renal failure. Treatment aims to stop the infection from spreading and damaging the kidneys permanently. As a result, it's important to educate the patient about early warning signs and symptoms, bacteriuria testing, and starting therapy as directed.
Patients with UTI are at risk of negative RAM, sepsis, and indwelling catheter should be avoided. The nursing intervention are the following: using a septal technique during insertion of the smallest catheters possible, and securing the catheter with tape to prevent movement, and frequently inspecting the urine color, odor, and consistency, and performing meticulous daily care using soap and water. In helping the patient to learn how to prevent or manage the recurrent UTI, the nurse implements teaching that meet the patient needs. Health-related that prevent the recurrent UTI are practicing personal hygiene, more fluid intake, and urinating regularly and more frequently, and adhering therapeutic remediation. Back to you, Janina.
Last but not the least, prevention from occurring this said condition can save people from having this. Here is Hind Al-Nakbi for the takeaway. Hind?
Yes, Janina. So how to prevent your urinary tract infection? For the fluid intake, first of all, you need to stay hydrated. Drink plenty of liquid, especially water. Drinking enough water is one of the easiest way to help and to prevent UTI. So, what happens when you drink plenty of water? Drinking water helps dilute a urine and also tensions that more urination which happens frequently, which allow bacteria to be flushed out of our body through the urine. Water intake should be about 6 ounce cup or 240 ml a day. Now, the second thing you can do is to drink at least 1 glass of cranberry juice per day. This may prevent second type of bacteria that can cause bacterial urinary tract infection, and also they may help in preventing future urinary tract infection. Avoid coffee, tea, alcohol, and other fluids that are urinary tract irritants. And for the hygiene, urinate when the needs arises. Frequent urination puts pressure on bacteria in the urinary system, and which can help to clear the bacteria out of the system. Shower rather than in the bathtub, because bacteria in the bath water may enter the urethra. Next is practice good sexual hygiene. Sexual intercourse introduces bacteria and other microbes from outside of the body to the urinary tract. So practicing good sexualizing can help to reduce number of bacteria that people can transfer during intercourse and another sexual act. So, example of good sexualizing includes urinating before and immediately after sex, using barrier contraceptives such as condoms, washing the genital, especially the foreskin, before and after engaging in sexual acts or intercourse. Next is avoid potentially irritant feminine products. Will also help in preventing urinary tract infection, like using deodorant spray and another feminine product such as powders in the genital area that can irritate the urethra and may lead to the urinary tract infection. Last is wipe from front to back. Wiping from front to back, doing so after urinating and after bowel movements, helps to prevent bacteria in the anal region from spreading to the vagina and urethra. For voiding habits, void every 2 to 3 hours during the day and completely empty the bladder. This prevents overdistension of the bladder and compromised blood supply to the bladder wall. Both predispose the patient to the urinary tract infection. Precautions expressly for women include voiding immediately after penile vaginal intercourse. Back to you, Janina.
And you have just heard the contents we gathered. Once again, I am Janina Abarin, and this is the News Nightingale. Thank you and have a good day.